Dispatch to a motor vehicle accident. BSI is on. Scene is safe. Mechanism of injury is a motor vehicle accident. I have one patient. Request ALS backup due to the mechanism of injury, and consider C-spine. And I will have one of my partners hold manual stabilization of the head and neck. General impression of the patient is the patient is laying down, eyes closed, early adulthood, and is male. As I walk up to the patient is not alert to my presence. Check for verbal stimulus. Sir, are you there? Sir, are you there? No response. Squeeze the trach for painful stimulus, and patient opens their eyes so they are oriented to painful stimulus. Chief complaint, since the patient is not alert, they won't give me a chief complaint, so it could possibly be multi-system trauma. Don't see any apparent life threats, so I'll assess the patient's airway. So we'll open the airway using a jaw thrust since the patient may have sustained a possible spinal injury. Airway is patent. At this time, since the patient is not alert, we will insert an OPA. So I'll measure from the tip of the earlobe to the tip of the mouth, insert the OPA, turn it 180 degrees. Patient doesn't have an attack gag reflex. So we're good on that. So next I'll check the breathing. So I'll open the patient's shirt, observe the chest, look for equal rise and fall, observe right rhythm and quality of the respirations. Okay, and patient is breathing 24 breaths per minute, shallow and rapid and shallow. Patient is breathing adequately. We will administer 100% oxygen via non-rebreather mask at 15 liters per minute, and I don't see any injuries that could compromise the breathing and ventilation of my patient. So next I'll check for circulation, so I'll check for pulse. Patient does have a pulse. It is rapid and weak. At the same time I'm checking the pulse, I'm checking the patient's skin for temperature, color, and condition, and it is pale, cool, and clammy. My patient is going through has symptoms of shock, so we will treat. So we'll look for any life-threatening bleeding, any blood under the patient, any major bleeding. Don't see any major bleeding, so we'll throw a blanket over the patient to conserve their body heat and position them in an anatomical position. And we are administering oxygen to help with the shock therapy. At this time, I'll consider the patient a high priority due to their orientation and the mechanism of injury, so we will prepare to transport the patient emergent. Next, I will try to obtain a sample history, but my patient is not alert, so I'll look for any bystanders or family members that are around and ask them of the patient's past medical history. Try to gain a sample history. Also, at this time, I will check for baseline vital signs. So I'll check for the blood pressure, wrap the cuff around, put my stethoscope on, pump it up, let the air out, get the systolic first, diastolic last, and the patient's blood pressure is 92/64. Next, I'll check for pulse, for right rhythm and quality. And the patient's pulse is 112, rapid and weak. Next, I'll check for patient's respirations. And patient is breathing 24 breaths per minute, rapid and shallow. Okay, so at this time, I will do a physical exam. So I'll start with the head. So I'll palpate the back of the head and the ears. Okay. Look for any wounds, tenderness, deformities, or crepitation. Next, I'll check the patient's ears. Check behind the ears for any battle signs, any bruising. Check the facial bones, the mandilla, the mandible, and the maxilla. Check the eye sockets. Check the nose bones, the cheekbones. For any wounds, tenderness, deformities, or crepitation. The next, I'll check the eyes. Make sure they have any, if they are reacting to the light. Check the ears for any fluid leaking out. No fluid. I'll check the nose. Any fluid leaking out. No fluid. Next, I'll check the mouth, see if there's any broken teeth or anything that could obstruct the airway. And airway is still clear. Next, I'll check the patient's neck. So I'll palpate and inspect the cervical spine. Seems to be for wounds, tenderness, deformities, or crepitation. Seems fine. I'll check the position of the trachea, see if it's in line with the body, and it is. And I'll also inspect or observe for any JVD, and the patient doesn't seem to have any JVD. So at this point, since I've checked the patient's neck, we will apply a cervical collar. So I'll measure for a cervical collar, and then we'll place that cervical collar. My partner will still hold C-spine, manual stabilization. So after that, we'll check the patient's chest. So we'll observe, auscultate, and palpate. Open the patient's shirt up, and we'll observe it, see if there's any wounds, tenderness, or deformities, and don't see any. So next I'll palpate the chest and check for wounds, tenderness, deformities, or any crepitation, any paradoxal movement, and don't see or feel anything. So next I'll auscultate. So I'll put my stethoscope on, measure under the clavicles, measure the sides, or auscultate the sides. And I'm comparing both left and right side, and lungs are clear. So next, after that, we will check the abdomen. So we'll inspect the abdomen for wounds, tenderness, or deformities. Next, we'll palpate the abdomen in all 4 quadrants. Make sure there's no distension, firmness, or if there's softness. The patient's abdomen is soft. So next, we'll check the bladder. We'll press on the bladder. Palpate on the bladder. Okay, so next we'll check the pelvis for any crepitation. So we'll press down on it gently, and it seems to be intact. So also we'll check the patient's genitalia to see if there's any feces or urine or any trauma to the genitalia or priapism. And it seems to be all intact, no trauma or anything there. So after that, we'll palpate the lower extremities. So we'll palpate it, and at the same time, we're checking for any blood, any wounds, tenderness, deformities. As I get to the feet, we will check for motor function. I'll have the patient push down on my hand and ask if they can feel me touching their foot, but the patient is unconscious, so they're not giving me any answer. Check for a distal pulse, and there is a pulse, so the patient is getting circulation to his right leg. So I'll check the next leg, palpate it, inspect it for any blood, any wounds, tenderness, deformities, or crepitation. Check for motor function and sensory function, sensation, and check for a distal pulse. And there is a distal pulse. The patient is not responding to the motor or sensation. Next, I'll check the upper extremities. So I'll check the arm for wounds, tenderness, or deformities, or any crepitation. And then I'll check for a distal pulse and have the patient squeeze my fingers and see if he can feel me touching his hand, but there's no responses. The patient is not oriented. Next, I'll check the other arm for any wounds, deformities, or crepitations, any blood. Check for pulse, and has the patient squeeze my fingers and if he can feel my touching his hand, but there's no response. The patient is still unresponsive. Since I checked the interior of the body, we'll check the posterior. So we'll check the posterior thorax. I'll have my partner who's holding C-spine count, and we'll do a log roll for the patient. So partner 1, 2, 3. Roll the patient over. Check the posterior thorax. Check the spine. Check on both sides of the spine. Palpate it for any wounds, deformities, or crepitation. Check the buttocks. And it seems to be all fine. No wounds, tenderness, deformities, or crepitation. So at this point, we will insert a backboard for the patient since we have the patient rolled up already. So we'll roll it under, put it under the patient. And now our partner's count, who's holding C-spine. 1, 2, 3. Lay the patient down. And we'll strap the patient. So we'll do the middle, we'll do the bottom, we'll do the top. And we will take the patient's head down to the spine board. At this point, I will manage any secondary injuries that I've come across while doing the physical exam. Didn't see any secondary injuries, so I don't need to manage any secondary injuries. For reassessment for this patient, we will do a detailed physical exam and reassess this patient every 5 minutes due to their critical condition being unstable. So we'll check the vitals. We'll redo the primary assessment for their see if their mental status is getting better. See if their vitals, there's any trends in their vitals, and we'll also check for any treatments that were applied to the patient, see if they are working or if there's any obstruction to them. And that completes my assessment.